Hello everyone, and a warm welcome back to my channel. I'm thrilled to have you here with me today. I'd like to take a moment to share something incredibly special that has been on my heart. As many of you know, I've been serving as a physical therapist for over 30 years in the United States. It's been my privilege to provide my services, dedication, care, and love to each individual who has crossed my path. However, I'm eagerly looking forward to the day when I can retire in just a couple of years. But what's next? After embracing Jesus Christ in 2021, my life has taken an exciting new direction. I've discovered new dreams and goals that fill me with excitement for the future. One of these new dreams is about sharing our story with all of you. Our story is a testament to the power of love and the incredible joy it brings into our lives. That drives me to be creators to give valuable tips and educational tools that will help everyone. I felt an overwhelming sense of joy while putting together this video, and it was truly special to share my journey with you all. I want to extend my heartfelt gratitude for being a part of my journey and for supporting me in this new chapter of our lives. Your love and support mean the world to me, and I can't express how grateful I am for each one of you. So, there you have it. A little peek into my lives and my plans for the future. If you enjoyed this video and found my story inspiring or uplifting, please show your support by giving it a thumbs up, likes, comments. And if you haven't already, please don't forget to subscribe or follow me to my channel so you don't miss out on any more exciting updates or tips and educational tools in the future. Thank you so much for joining me on this journey together. Watch, listen,
Frozen shoulder, also known as adhesive capsulitis, is a condition characterized by pain and stiffness in the shoulder joint. The exact cause of frozen shoulder is not known, but there are several factors that may contribute to its development. These include 1. Immobilization, prolonged immobilization or lack of use of the shoulder joint can lead to the development of frozen shoulder. This can occur after a shoulder injury, surgery, or due to certain medical conditions that limit shoulder movement. 2. Diabetes. People with diabetes are at a higher risk of developing frozen shoulder. The reason for this is not fully understood, but it is believed to be related. 2. Changes in the connective tissues and blood vessels. 3. Other medical conditions. Frozen shoulder can also be associated with other medical conditions such as thyroid disorders, heart disease, and Parkinson's disease. Treatment for frozen shoulder aims to relieve pain and restore shoulder mobility. The following treatment options may be recommended. 1. Physical therapy. Gentle stretching exercises and range of motion exercises can help improve shoulder mobility and reduce pain. Physical therapy may also include techniques such as heat or cold therapy, ultrasound, or electrical stimulation. 2. Medications. Nonsteroid anti-inflammatory drugs NSAIDs may be prescribed to reduce pain and inflammation. In some cases, corticosteroid injections may be used to provide temporary pain relief. 3. Hydrodilatation. This procedure involves injecting fluid into the shoulder joint to help stretch the capsule and improve mobility. 4. Manipulation under anesthesia. In this procedure, the shoulder joint is manipulated while the patient is under anesthesia to help break up adhesions and improve range of motion. 5. Surgery. In severe cases where other treatments have not been effective, surgery may be considered. Surgical options include arthroscopy to remove scar tissue or manipulation of the shoulder joint under anesthesia. It is important to consult with a healthcare professional for an accurate diagnosis and appropriate treatment plan for frozen shoulder.
The shoulder joint can exhibit the following motions. 1. Flexion, moving the arm forward and upward, bringing it closer to the body. 2. Extension, moving the arm backward and downward, away from the body. 3. Abduction, moving the arm away from the body laterally. 4. Adduction, moving the arm towards the body medially. 5. Internal rotation, rotating the arm inward towards the body. 6. External rotation, rotating the arm outward, away from the body. 7. Horizontal abduction, moving the arm away from the body in a horizontal plane. 8. Horizontal adduction, moving the arm towards the body in a horizontal plane. 9. Circumduction, a combination of flexion, extension, abduction, and adduction, resulting in a circular motion.
You got it? Hi everyone. Again, I would like to review the previous one. The motions, the range of motions on our shoulder. Okay? Flexion, that will be 0 to 90 degrees. It's just functional. If you go beyond it, it's 180 degrees. That will be good. Now, extension, 0 to 70 degrees or 80 degrees. That will be the normal. You cannot go beyond on that. Okay? I can go beyond more on that. Now, abduction is towards away from your body. That will be 0 to 90 degrees. Beyond that, horizontal is better. It's very good. Now we're going to adduction towards your body. That will be 45 degrees in there. Okay, that's where from the movements from your out, that's where the adductions of the shoulder. Now we're gonna go to external and internal rotations. Okay, this is external rotation, 0 to 45 degrees. No pain. That will be very good. Going in, that's internal rotation of your shoulder. Now, this is the circumduction. You can do this 10 times. 2. Rest after 10 times. And you can do 2, 3, whatever, normal, you can do that. And going out, that's where the circumduction, right? Go all the way, everything, start it up, and rotate your shoulder. That will be good. But let me save this again. My video will this is only my recommendation as a physical therapist. I assess if it's very involved. I had another technique that we really need in the private practice clinic or in the home care if I visit into your home. But I don't want the family out. No, let's go with the basic exercises for the frozen shoulder, where you already been seen by specialists and diagnosed with frozen shoulder. Okay, guys, the first I just recommend. It's based on my experience as a physical therapist. You can have other therapists maybe that will give you a different one, but my first one that you need to have, or you can ask help with your family. If you can make it by yourself, it's very good. You need a stable furniture in the house. I like the kitchen. It's more stable on your kitchen. The sink area, if there's a good space in there, if you had a heavy furniture. So you go there and you're gonna lean over. You call it a pendular exercise. You can do beyond the stretching. See, you just hang your hand, hang your arm, just do pendular. We can move to the side to side. You can make it turn around. Just hang, no pressure, no strength, no resistance on your shoulder. Okay, base. If it's painful, you stop. Okay, you can make a rotation towards outside, make rotation towards inside again, side to side, right to side, right to left, or go forward and in, forward and back. Once again, rotation. That's the pendular stretch. Let me save this. Now the second exercise is like you can use a towel. This is like a stretch and strengthening to your shoulder muscle. Okay, like to strengthen in from flexion. You can go there, up and down. The other one is to stabilize, up and down. And the other side, you can do up, pull, pull. I had a small towel so you can go beyond. It will add and pull. You call it isometric. Hold it there for like 3 counts, 5 counts. Now the abduction, the adductor strengthening for your muscle in your adductor muscle and abductor muscle. I don't know how to, but I'm using, that's why I wanted to know the terms. Okay, going out. See, 1 together. You try to pull it out. That's where your abductor muscle. Now, in going to your adduction, it's really your abductor. The problem in that abductor is you're gonna hold it. You start horizontal here, and you can pull it. See, pull it. That's where, hold it there. 1, 2, 3. Okay? That's where your adductor muscle. Okay? You're gonna go with your adductor muscle. Just pull it up. You can feel once again both of your abductors and your adductors is working in this when you do isometric. Just hold a towel and count it there and pull. Pull as much as you can. Okay? Guys, the third one is the third exercises I can recommend for the frozen shoulder. If you're in the clinic, you're gonna use the finger ladder in there. We had a shoulder wheel in there. I will show you at the end of the video. But today I will going to show you can, if you can able to stand, so do it. If you need a help, you need to have a help. If your balance is not good, so ask help for your family, your home attendant, or anybody that can help you. Okay? Usually, if you want to go for the flexion, I'm just gonna show my arm. Okay? See? You can start your finger here, or you're sitting down, whatever, and go all the end. We had this thing in here outside, so just bear with that. Finger, slowly move to yourself. Those who can still make it. Some, if you had a problem, stay in there. If it's painful, you support yourself. Okay, with your other arm, and go on to the last degree of the pain. Stop when it's painful. Okay, but those who can go, you just keep moving until to the last degree of move until it's painful. Stop, calm down. Okay, that's the flexion. Okay, that's flexion towards your flexion and extension too. It's strengthened and it's increased the range of motions. Now in the abduction, okay, just gonna show you to you. You're gonna go sideways. Okay, you're gonna move to the wall. Okay, finger or your hand. See, start, go up, move when you're gonna all the way. Okay, until the last degree of your pain. It's already been so painful. Stop. Not gonna go through. Go all the way. I can still go, but I don't have a pain, so a lot is only out. If it's only up to 90 degrees, stop at the end when you had a lot of pain. Don't. That's where you're gonna stop. You can do this. These exercises, finger ladder exercises, as tolerated. If you started, maybe you just start about 3, 4, 5 times in the morning and the evening. You know, you had to. Don't go too much. Remember, the first time you're gonna do, there will be so much pain, lactic acid productions in there, just like new thing to you. That's normal, but you can reduce your exercises. Now the third one, okay, that's the abduction. I like to share with you, I had a TheraBand. Okay, this is the green TheraBand. See, the same as I described with you. It's for this, it's very good. We're gonna go with a good angle. I wanted a very good video, but it looks like it's dark. I'm against the sun. Let me find my way over here maybe. Oh, this is a good one. Okay, this is a TheraBand. They have some retail in it. You can buy a few, you can just buy a lot. We had in the clinic a bunch of it, but I saw there's also a space in that. This is based on the color. I like the red for the start if you just started, but there's a different color in it. They call it TheraBand. It's like a rubber. Okay, see, you gotta hold in this one. For the flexion, you can either tie it in your chair while you're sitting down. Okay, and people who cannot do some standing, you can just sit down. Okay, I like that to show you for those people who don't sit, and those people it's easy for you to sit. Okay, flexion. See, 1, 2, right? 3, 4. Okay, go on like around 10 reps and just rest. You do 3 sets as a start, then do it twice a day. And then let me take it out now. And how to do your extension. The extension strengthening with this TheraBand. You can position here for the flexion, for the extension. Okay, this is you had to hold this way. Okay, that's where your extension to the back of your hand. Extension. See, whatever you tolerate, it will help you a lot. Extend. You do, my favorite is really 10. So do 10 reps, 3 sets. That's where I start all the time with my patients for 2 weeks. Then you can increase the resistance and the repetitions. Okay, now the abduction is easy. You can go shortcut to put it, those who are healthy. 1, you go straight to 10. 2, that's the abductor muscle to strengthen. 3, 4, okay, 5 to 10, 6. But this having a lot of really problem, you can just do it one at a time, right? So sorry, you can see my head. Just want the camera. I had no perfect camera right now. I'm using my iPhone. For the people that you want only one at a time, because it's really painful. So you, as I said, tie this one in your wheelchair, in your chair. Let's see, I'm holding in the other side, but you're tying it in there. Abduction. See, 1. See, you tie it. 2. Oh, you're not seeing me. Just go like this. You just tie it. How will I say that you can see the exercises? Okay, again, tie the other side. See, that's abduction. Towards out. Your hand is in 90 degrees in that position. 1. Okay, the same in the other side. Okay, I'm not gonna shoot that to you. As I said, 10 reps, stop and rest, and then you do 3 sets in the morning. So that's about 30, right? For the first week, just stop. Don't go too much. Okay. And the next one is the adduction. That's where tie the other side, but the adduction is really it's good in the gym. In this, they're the way to exercise the adduction. But for me, you can hug yourself. That's your adduction. See, hug hard. 1, 2, 3. Okay, do 10 times. Just hug yourself. Hug with love with yourself. That's where your adduction. And push it all the way to. Stretch it out. Push. Hold. It's like isometric. 1, 2, 3, 4, 5. That's where your adduction, right? 1, 2, 3, 4. Okay, that's what the same. You can do 10 sets and rest, and 3 sets. No, 10 reps of that adduction exercises for your adductor muscle, and 3 sets of 10. And if you can make it twice a day, it's good. And increase as you go along. You're improving your endurance. I already explained that before. This is the way to test your activities tolerance, right? So hopefully you remember my previous video, or maybe I'm gonna put that up again and watch it. I will explain what is endurance. Let me stop. There's a train again, and the last, I think that's it, right? So that's where the adduction and the external rotator is really, it's nice to have it when you explain. That's where the side that I said, that's where part already, you're already doing the external rotations. But I will show you when you're lying down. Okay, it's better you lie, like imagine I'm lying, right? So the external rotator is, I like when you had frozen shoulder, you can control yourself. Okay, let me hold this. I don't know how to hold it with me. Okay, let me say I'm lying, right? always protect your shoulder in there. You lie in this position, you lie down, you're in bed. Okay, my lights is already off in the front. I hope it's still good. See, that's where the external rotation. See, like everything has been supported in the back. One day I will gonna go just a quick review. See, that's external rotation, and that's internal rotations going down. But on here too, if you had a weights though, but it's, see, you can do that too. 1 and 2 and 3. Just don't start with any weights yet. When you started, as you go along, you can have a dumbbell in there and start with 2 pounds. Okay, that's the exercises for all your ends. And then the circumduction, that's where the best exercises for those normal. But if you have already pain, you can start, you can do circumduction. It will improve your endurance, your strength also. You increase, you go straight. Okay, every day 1, 2, straight to 10. Okay, and out 1. That's where the circumduction. You can do everything. And sometimes I recommend, because I had a really, just to stand up in the wall or sit in front. Me, I'm an unable person, so what I do, I like to stand in the wall and just stand in the wall. Okay, like do stretch over there. I don't know if you can see me, like about how many minutes you can tolerate. Okay, stand in the wall, and maybe, oh, we had a lot of things in here. Maybe you stand in the wall with your back. I told you my back is not that perfect too. Okay, that's my stop there. So you stand in the wall. That's what I do in the morning before going to shower. So I usually stretch myself. My goal is to stretch out, to stretch into the wall. Okay, that's my goal over time. Okay, in the morning, how much tolerance you can do? Do you think you can do for the first time 2 minutes, 3 minutes? Your goal is to reach the wall. Okay, mine is really hard, but at least I maintain my full range, functional range of motion. See, I hold my hand and reach it out there. I hold it there for a few minutes. If you can make it 1 minute, 2 minutes, 3 minutes or more, like 5 minutes maximum maybe. I never did. What I do is only 3 minutes to 5 minutes. Okay, so that's where I like. But those people that are more involved, please take a professional to guide you to your doctor, to refer you to a physical therapist like me, and hopefully it gives you a lot of valuable lesson. And as a creator, I told you in the beginning, I will do as much as I can to help all of you. This is just like serving God, as I told you. And at the end of this video, guys, before I'm gonna end, this is the last one, funny, promise. I never gave the exercises for the aggressive stretching as well as the stretching to after surgery. These people who had after surgery, it needs very fragile, and you need to consult into your doctors as well as your physical therapy. You need to go to a clinic, a private practice clinic, and what else? They call it a manual therapy as well as a contract relax. I love the contract relax technique from our practice, and it's not gonna be recommended to you at home, to your family. I needs a specialty like me, as well as other specialty, you need to go and consult. And what else? Here, the institution. If you want again to mention you to market your product, the TheraBand has some dumbbells where to get it. If people, those who had minor pain or no limitation of motions, people who just feel like me, who's been think that we are already getting aging. We need to condition ourselves to make a shortcut, especially those here in the USA. We are go run and we had our job, we had our work, so we want it quick. So you can use the TheraBand as well as a little low resistance dumbbell. It's very, very good. You can start with 1 pound, 2 pounds, and 3 pounds. And those institution, please to mention you to where to get it. Thank you, and have a good day. Thank you. God bless everyone listening to this. And me